cell repolarization occurs due to outward movement of potassium. Depolarization occurs when sodium goes inside and repolarization when potassium comes outward of the cell membrane. 16-year-old patient present with 15 years of diabetic history. How to check long glycemic control? We will check glycosylated hemoglobin. Next one is a patient. Which of the following is connective tissue in the brain? It is oligodendrocytes is connective tissue in the brain. Para nervous supporting cells are pituocytes, nervous supporting cells. A 16-week pregnant lady with ultrasound increased amniotic fluid. She has advised beta HCG, and after 2 weeks of alpha fetoprotein, AFP comes outward to be raised. What is most likely diagnosis for this condition? Most likely diagnosis is there is raised beta AFG, raised beta HCG, and AFP is coming out. What will be the diagnosis? The diagnosis is anencephaly. In anencephaly, there is no development of the brain, and that results into the condition. Crista gallis is extension of which bone? It is ethmoid bone. Sella turcica is part of sphenoid bone. The potassium proton pump in parietal cells controls potassium is controlled by potassium alpha. Next one is a patient present with palpitation having absent P wave, irregular pulse and irregular RR interval. Most likely diagnosed mitral stenosis with insufficiency. Next one is which anti-tuberculous drug is orange color urine? That is rifampicin causes orange colored urine. A patient on peritoneal dialysis has plasma potassium 6.5. What will you advise to the patient? We will advise carrots to the patient. And the next one is during fight person hit with the knife and cause stay with the stomach bed. Which artery is damaged? The stomach bed is splenic artery. Now we will be looking at the normal anatomy of stomach. In this picture we can look at the arterial supply of the stomach, that is short gastric artery supplies to the fundus and to the greater curvature there is left gastroepiploic artery, and lesser curvature there is supply of right gastric artery. Gastroduodenal artery supplies the gastroduodenal junction, and there is left gastric artery gives off branch to the short lesser curvature. And then there is also, now we will be looking at here in this picture which is clear.